Thank you, AG, and thank you all for coming to attend this. Please, I must admit, we have been able to contain the virus only through some supportive measures of getting borders controlled well. We've been able to recreate some degree of readiness in terms of the health services. And we have been in the forefront of trying to sort out community initiatives that will help us regulate for people to regulate behavior. So with all things in place, we were able to stop the epidemic from getting any worse. Given that we've had some degree of control, we are now, as a group of health, as a Ministry of Health, we are now worried about livelihood. In the same way that there are health effects from COVID-19, we are aware that there are health effects from lack of livelihood, and I've mentioned that before. Today, this morning, one of the reasons I'm in the West is because we just went through, together with one of our military contact point for the incident management team. We've just gone through the airport, went to Nadi, went to a few other of our quarantine facilities to ramp up our measures that we have been applying from some time ago. And for us, the implication of some of the lanes that have been is that as you open up lanes, the ministry recreates new high-risk groups. So, for example, I went to Tanua today just to explain to the people in Tanua, the manager of Tanua, that we will use your workers as a high-risk group. So what you need to do is you must make sure that anybody with symptoms, you screen and do your symptom check and your thermal check every day. And you have to have a attendance roll. And anybody who's absent requires somebody to ring him up and say, what's wrong with you? And if they report that they have some symptom, we have the rapid response team headed by Sam Fullman in Nadi. He's ready to run down to people's houses and swab them and check them and contain the family. So I'm just highlighting that as the depth to which we are going to ensure that we have some latitude in allowing a return to some degree of livelihood and opening borders. There are other measures that would be fairly overly detailed if I was to go into them. But suffice it to say that we are working with military and a number of border control officials pulled together and to regularly update our containment measures. The amount of work that is required to do that, we are hoping that that would allow us to then say to people, please start earning more money so that you could feed your family and you could put something on the table that is sufficient for all. I think I shall stop at that point because that's a summary of where we are, what we are doing. But if you do have specific questions, then I will answer those.